Welcome. In this session, we'll explore Evaluation and Management, or EM codes. What are EM codes? These codes, ranging from 99,202 to 99,499, are used by physicians and qualified healthcare professionals to report services like office visits, exams, and patient management. Purpose of EM codes. EM codes represent interactions between providers and patients. They are submitted to insurance companies for reimbursement and also help healthcare facilities track services. Because EM coding is high volume, accuracy is critical for compliance and avoiding costly errors. Examples of EM services. Common EM services include office and outpatient visits, hospital rounds, home healthcare services, and preventive medicine visits. These are distinct from procedures like surgeries or diagnostic imaging, which fall outside the EM code range. Typical format of an EM code. Let's look at how EM codes are structured. Take Captain Code 99235, for example. It reflects an inpatient or observation care visit with admission and discharge on the same date, requiring a moderate level of decision-making and at least 70 minutes spent by the provider. Updates to EM codes. EM coding continues to evolve. Major changes in 2021 revised codes 99,202 through 99,215 to focus on decision-making and time. In 2024, the wording for time was adjusted to require a minimum time to be met or exceeded. Common EM terms. A few key terms. A qualified healthcare professional, or QHP, is licensed and can independently bill for services. Clinical staff support them but do not report codes. A professional service refers to face-to-face care, and it's used to determine whether a patient is considered new or established. New versus established patient. A new patient has not received any face-to-face service from the provider or a same specialty colleague in the last 3 years. An established patient has. These definitions affect which EM codes can be used, and they vary slightly between AMA and Medicare. EM levels and MDM. EM services are assigned different levels, from straightforward to high, based on complexity. Codes may also be chosen using the total time spent. Not all settings, like emergency departments, allow for time-based coding. Total time in EM coding. Total time includes both face-to-face and non-face-to-face work by the provider on the day of the encounter, such as reviewing labs, documenting notes, or coordinating care. Time spent by clinical staff is not included. What not to include. It's important not to double count work. For instance, time spent interpreting tests should be coded separately. If both a procedure and EM service are done on the same day, ensure the EM portion is clearly documented, and use Modifier 25 to indicate it. Unlisted EM and special reports. When no specific captain code fits a service, use unlisted codes like 99,499. In such cases, you must submit a special report detailing the nature, time, and complexity of the service to justify reimbursement. EM code categories. EM codes span a wide range of services, from office visits to behavioral health, critical care, newborn services, and transitional care. Knowing the categories helps you choose the most accurate code based on the setting and service provided. Thank you for watching the video.